You're watching Reality Check. As a third COVID wave rises in India, doctors and medical staff at the front line of fighting the virus are increasingly become its targets. In hospitals across India, frontline medical workers are getting infected with COVID, taking them out of action and increasing the load on an already strained medical system. In West Bengal, over 250 doctors, hospital staff and students in different hospitals test positive. In Delhi, over 150 doctors have tested positive across different hospitals. In Bihar, over 100 doctors and medical students positive. In Uttar Pradesh, at least 35 hospital staff and one emergency doctor positive, all in a single hospital in Lucknow, in Medanta. In Patiala, Punjab, over 100 doctors, staff and students have tested positive at the government medical college. This is according to media and other reports. And of course, there could be many more. My colleague Saurabh Gupta spoke to doctors in Bombay's St. George Hospital, home to around 140 COVID patients, where 42 doctors have been hit by COVID, including this doctor who tested positive just 5 days ago, has tested negative and has just come back to work.
Actually, 5 days back we got some symptoms, so I tested, so got positive. And means frequently we are in contact with the patients. You all know that suddenly the surge of patients has been increasing and mostly gets the symptoms, and also they are getting positive, and the admission rate is also increasing. So in getting in contact with the patients, all are getting positive. It's difficult, but we have good colleagues. They manage to work, keep going the work, because we can't stop this. Okay, if 2 or 3 are get positive, then others are taking all the works, and they are doing, means one is doing the work of 3, like that they are managing. And soon I get a negative, I have to resume my duties, because it's a need of our.
The hospital's administration, however, says that while resident doctors have been testing positive for the virus, they were able to get back to work.
So since yesterday, 40 to 42 resident doctors have turned positive. But the good thing is, those who have were admitted earlier, many of them are getting discharged, and they are fit to resume their duties as well, and they are also willing to join the duties, because they also know that we have a deficiency of working staff here, particularly doctors. So they are resuming the duties and they are getting back to work. But yes, healthcare workers are getting affected.
Now, this latest challenge comes at a time when thousands of resident doctors are on strike, demanding the entry of medical graduates whose joining has been caught up in a legal and policy wrangle. Sonakshi Chakrabarti, my colleague here in Delhi, spoke to a COVID healthcare worker in the capital city who, on the condition of anonymity, outlined the extreme stress they faced.
The pressure is building up. Daily we are seeing many patients, symptomatic patients, many resident doctors coming for testing. Our work is almost tripled 4 times. It is increased that much that we cannot handle that work right now. The work is increasing and the burden is building up. Generally we used to do 6-hourly duties earlier, but now as the COVID cases are rising, we will be doing sometimes 24-hour shifts, sometimes 48-hour shifts, and that too in PPEs, without eating anything, without drinking anything. So it's very difficult to do those shifts, but then we have to.
Yes. So you're telling me that it can go up to 38 hours. It would cost 30 hours easily.
Actually, our healthcare system is seeing a shortage of doctors, as one entire batch of PG resident doctors haven't joined. So we are working at 2/3 of the capacity which usually we work with. So that's why the pressure on us is building up. And yeah, definitely if doctors get positive, then they are isolated and some are quarantined. So that also subtracts many doctors and the burden builds up.
All right, joining me tonight on Reality Check, we have with us Dr. Padma Srivastav at the Chief Neuroscience Center, AIIMS, Dr. N.N. Mathur, who's Professor of Excellence at the Lady Hardinge Medical College and Hospitals, which is again government hospital here in Delhi, Dr. Hemant Deshmukh of KEM Hospital in Mumbai, Dr. Anustup Mukherjee, who's Junior Resident, Calcutta National Medical College. But let me start with Dr. Suvrankar Datta again of AIMS, who's also General Secretary of Federation of Medical Association. Now, Dr. Datta, from what I understand, you yourself have COVID?
Yes, Srinivasan, yeah. I am currently quarantining at my home.
Oh, I see. How many days ago was this?
So I had symptoms on 31st, so I got my COVID test on the evening, and I got it positive by the night.
Okay. Well, I hope you're doing okay, because
yeah, I'm much better now. Like the first 2 days were a little difficult, but now yeah, I'm recovering. Thank you.
Okay, touch wood. But tell me now, was this something that happened to you while you were at work in the hospital, or it's hard to say what happened? And also, is there a problem now? You're seeing several other doctors, getting infected. We saw that in the first and second wave. Seems to be happening again.
Yeah, right. So frankly speaking, it's very difficult to tell from where you get COVID. It can be anywhere. It can be at your home, at your workplace. You can get it from anywhere. Definitely, healthcare workers are a little bit more exposed because of the kind of work we do and for being at a higher risk at our workplaces.
Right.
But it's very difficult to tell. Yeah.
But you were vaccinated and all of that?
Yeah. In fact, this is my second time I got COVID. I got COVID during the second wave as well, after which I took 2 doses of vaccine. And this is the second time I'm getting an infection.
Okay. Well, we hope you make a full recovery. Dr. Mathur,
thank you.
How is it at Lady Harding? Do you have several doctors and medical staff down?
Well, I do not have the data as of now, but yeah, there have been reports that some of our resident doctors and some of our faculty has contracted infection in last 1 week. And as you can understand, doctors are the front lines, and
yes.
Their work is such that they many a times do not know that the patient whom they are seeing is affected, and they work in a relatively less ventilated area.
Yeah.
And they operate on cases, though they get the tests done, but there is a lot of aerosol generation because of the situation in which they work.
Of course.
So they are very much at risk, and they are getting affected.
Is it impacting in any way the sort of functioning and of the hospital?
Yes, so we do factor in. Well, in last 1.5 years, we have factored in these situations of COVID and recruited the staff accordingly. But still, again, the wave has come and it does affect, and so much so that these days we are having some medical examinations also. So both the examiners and the examinee, both are doctors, and they are affected. Like there is some exam tomorrow, and half the force, both the examiners and the examinees,
right,
are affected.
Okay. What about you, Dr. Deshmukh at KEM? Is there a problem with people getting infected?
Good evening, Srinivasan. We now understand in 2022 that entire batch of postgraduate students is not around to help us with the COVID work. So the only way out right now, after 157 healthcare workers getting infected in the last 4 days, that is an average of 40 per day, the numbers is going to increase in the days to come. What we are really wanting to do
Sorry,
is,
just 1 second, just to jump in. 157 healthcare workers
are positive in the last 4 days.
Where? In
KEM hospital.
Oh, just 157 in just KEM in the last 4 days?
Yeah, that's an average of 40 per day.
That's huge.
That's a huge number. So all these healthcare workers as well as frontline workers are getting infected, not necessarily after seeing a patient. I think the entire population moving around in the vicinity of the hospital are probably infected, and they are probably asymptomatic carriers of the disease. Now, what we are seeing right now is a mild disease, but hardly anybody is coming with a lung infection. Most of them are coming with sore throat, irritating throat all the time, body ache, a lot of headache, and most of them recover within a period of 2 to 3 days. What we have seen in Bombay,
No, that's of course reassuring that it is not as severe as it was earlier, and fingers crossed it stays that way. But I do want to ask you then, Dr. Deshmukh, how is the hospital functioning with such a big group that's in a sense out of action?
Yeah, one more disappointing point is about 3 weeks back we had just 6 patients in the critical ICU. Right now we have more than 115 patients admitted. So that's a huge jump of critical patients with COVID getting admitted in the last 3 weeks.
115 critical COVID patients in the ICU.
ICU right now within a span of 3 weeks. So now this makes a difference that the last wave we were seeing mild patients, moderate patients as well as severe patients. But here we have right now seeing severe patients also. But fortunately only 7 patients are on oxygen. That's a very good point because most of these patients who are getting admitted as critical patients will have some kind of comorbidity, either a kidney disease or a heart ailment or probably some kind of malignancy. And most of them are well managed in the ICU right now.
Okay, but that's just, before I move on very quickly, that's what I was trying to understand, that with this huge jump in the number of patients requiring critical care, but a big drop in the number of medical staff, like you said, so many of them, 157 sick or rather infected. Isn't that putting a pressure or a load on the
Yes, definitely this is putting a lot of infrastructure problems. But what we are trying to understand is get the non-emergency work curtailed. So any routine work can definitely wait for a period of 2 to 3 weeks till the entire pandemic or this COVID surge flattens down. So that all the resources are diverted to this critical patients and not definitely managing a routine surgery or a routine admission. All the resources have been diverted there.
Okay, so you've had to prioritize. Dr. Srivastava, again with AIIMS, what's the position like with doctors or medical staff getting infected?
Yeah, good evening. So I do echo what the others have just said. So the burden, the numbers are very similar in AIIMS as well. And I'm in the Department of Neurology, and in our department itself, as has been said before, and this is not, this is a super specialty, and we have a lot of non-COVID emergencies out here. And we have similar numbers. So we've also crossed 100, which is in AIIMS per se, and I think counting every single day. But I just want to bring up few other points.
Sorry, 100 in AIIMS, overall in AIIMS about 100, is it?
100, and I think it's counting.
100
I
counting,
think we're counting.
Yes.
Yeah. So I said that, but I just wanted to highlight a few more points out here. One is that, when we are talking about it being a so-called mild illness, it's certainly not that, because if you multiply by population dynamics, what little percentage that we have, the published figures are that we have severe illness in 29% in Delta plus and 9% in Omicron. But 9% into the kind of dynamics we have, it certainly be a tsunami. And it would be foolish to go headlong into that tsunami. It is definitely the time to duck and save, oneself and the others.
Of course.
Said that, the thing is that, the other thing which has been raised again and again, that it's a mild illness, we really don't know much about this virus, because in neurology, we have a whole lot of long COVID with Delta plus. I don't know anything about the long COVID after the so-called asymptomatic of Omicron. So, you're looking at other aspects that we don't know of. So it is better to be aware and take
No, I agree with you.
The third point, though, is, there is a non-COVID emergencies. There are people out there having road traffic accidents, there are heart attacks, and there are strokes, and there are a whole lot of non-COVID emergencies. We also need to deal with that besides the COVID care. So it's become a double whammy. And therefore, we probably, are not just going to take care of oxygen shortage, and, everybody is talking of oxygen shortage and beds and ICU beds.
Yes.
It's high time we talk about healthcare workers.
Okay. Dr. Mukherjee, junior resident, Calcutta National Medical College. Now, this is something which has happened, this third wave coming and doctors and medical staff falling sick, even as there are these protests going on, right, with all the resident doctors protesting. These are the protests to say allow we'll play you those pictures as well, allow these graduates, I think there are about 40,000 plus graduates to join. It's caught up in some kind of legal administrative wrangle. So it's almost like a double whammy that we've just heard some of these others doctors talk about, that you don't have these graduates to help the residents who've been working long hours, and then on top of that, people are falling sick.
Good evening, everybody in the panel. Actually, this was the main point which we raised during our protests everywhere around the country, that we were actually thinking that probably a third wave is round the corner, and that is why the legal problem that was going on, that needs to be sorted out as quickly as possible, so that we can get the number of residents and those who are waiting in the queue to join us as a workforce. Nevertheless, yes, we were given some assurances, and now the wave has already hit us, and the problematic part is that within a matter of say 4 to 5 days, it has gone to an extreme peak. I mean, even 4 to 5 days back, the number of doctors, the number of healthcare workers who are being affected, the number was very small, and now it has gone to a peak. It has almost, if you know the statistics, it is almost greater than 250 in all the major hospitals in the city of Kolkata, and so it is a huge number. And so this is actually already a burden that we have been discussing.
250, so, you're saying, across the whole city in terms of doctors?
Yes, absolutely. The number is staggering. The number is absolutely staggering, and there is a terminology called the positivity rate, the total positivity rate, and it is.
Okay. All right. So yeah, that's quite a large number
right now.
Okay, that's quite a large number. But just going back to this, Dr. Mathur, because I wanted to ask you that, the period of isolation or quarantining, I believe they've already shortened it somewhat, and we had a panel of doctors yesterday as well saying that's irrational. You can't have 10 days, 14 days now. You don't need that with Omicron, and also how are doctors going to get back to work? So is the shortening sufficient, or do you think it has to be shortened more? What do you think?
I'm sure it has been done with a lot of deliberations, and today the Ministry of Health has issued the notification, and it says that the isolation period is now 7 days from the day you get tested positive, provided that you have no symptoms in last 3 days. So if you have the symptoms persisting, then it gets extended. But those with no symptoms for the last 3 days in those 7 days get out of isolation in 7 days. I think it is quite reasonable because Omicron till now had been behaving like that only, that we expect the isolation period can be reduced to some extent.
So that's helpful. That would be helpful for hospitals like yourself, your hospital as well, that if doctors can come back to work faster.
Yeah.
Is that, and you'd agree with that, Dr. Deshmukh?
Yes, very much I agree with whatever has been said.
So that shortening the quarantine or the isolation period.
Yeah, we cannot shorten more than 5 days because that's the minimum that is required to recuperate. And this is going to give the doctors or the healthcare workers enough energy to spring back to action in the hospital.
Right. But the problem still remains about this strike, does it not, Dr. Datta? Because these protests, I mean, this is another challenge, that there are so many of you young doctors protesting that itself, those protests itself can become risky, can,
Yeah.
be a super spreader
Yeah.
kind of.
So, yeah, Srinivasan, I think that's definitely a point which we are deliberating upon in our meetings regularly with all the RDs across the country regarding our next step if the incoming residents and the allocation of the postgraduate seats are not done ASAP. But I think like two things I want to reiterate here is that Omicron is not a mild infection. It is milder than Delta, definitely. But the way it is being projected that people are absolutely callously walking around. Like I stay in Delhi, I am seeing not a single person wearing a mask outside in the colony where I live.
Yeah.
And I think the message should go out very loud and clear that Omicron is going to affect a huge number of the population.
Yes.
And we are going to definitely see a scarcity of beds in the near future if we don't prepare.
Yes, that's what Dr. Padma was saying as well. And at least we are starting to see some sense now, when it comes to our political class, we are seeing, politicians and they're cancelling or postponing some of those big rallies, which made no sense. You can't be giving guidance, telling people to be careful and then also holding huge rallies. So at least that's the good news. But last word from you, Dr. Padma, you say that with this fairly sizable number in AIIMS that could be positive, is that impacting services in AIIMS in any way so far?
Right now, no. In fact, we are making sure it doesn't. So, by nature, we are not quitters. Somehow the medical profession is genetically programmed that way. So, it's not hampered yet. But if this tsunami hits and we are foolishly going into it, as I said before, head first and not ducking, then it will impact. So, I think, I hope the good sense prevails at all quarters and we won't have to do that.
So the way that it's not impacting is how? Does it mean that doctors and medical staff have to do extra shifts, or like they have to, pull their weight more to?
Yes, definitely. That's a big thing that is being contributed to. And I think across the panel, all of them would agree that that's what's happening.
Okay. All right. Well, fingers crossed. Let's see how it plays out, especially for our frontline workers. But thank you all so much for joining me on Reality Check. That's all the time we have. Good night.